Today we have the privilege of having Dr. Pauline Rose. Dr. Pauline Rose is Professor of International Education. She's Director of the Research for Equitable Access and Learning Center in the Faculty of Education, University of Cambridge. Prior to joining Cambridge, Pauline was Director of UNESCO's Education for All Global Monitoring Report. Pauline is author of numerous publications on issues that examine education policy and practice, including in relation to inequality, financing, and governance, and the role of international aid. She has worked on large collaborative research programs with teams in Sub-Saharan Africa and South Asia examining these issues. Throughout her career, she has worked closely with international aid donors and non-governmental organizations providing evidence-based policy advice on a wide range of issues aimed at fulfilling commitments to education for all. Thank you very much for being with us, Dr. Pauline Rose. It's a privilege and honor to have you, and over to you.
Thank you so much, Taiba, and thank you all for joining. It's a great pleasure to be here with you, including nice to see some familiar faces. We've collaborated with colleagues in LUMS and Ideas in Pakistan, so great to be able to have this opportunity. I'm going to be talking about work that we're doing in Ethiopia. Although a very different context, I suspect that there might be some synergies and things that we can sort of consider in relation to where are there these synergies and maybe differences, in particular in relation to the implications of COVID-19 on education. So I'm planning to speak for about 20-25 minutes, and so hopefully there'll be plenty of time for discussion. I'm just going to quickly share my PowerPoint, so hopefully you can all see this. So the work that I'm going to be talking about is in collaboration with Addis Ababa University and the Ethiopian Policy Studies Institute. It is under the guises of the RISE program, Research for Improving Systems of Education, which I know also some of you are involved in the Pakistan aspect of the RISE program. So again, there'll be some synergies, I think, in terms of the work that we've been doing. So the RISE program in Ethiopia began by wanting to look at how the government's nationwide quality education reform program is designed and implemented to improve learning outcomes, with a particular focus on the most marginalized, which I'll sort of say a bit more about in a moment. And given that this started about 3 or 4 years ago, I guess 4 years ago now, but of course, like everything else, has been disrupted by COVID. So we added a clause to this overall objective to say, how has this been affected by COVID-19? Because it would be impossible to look at the impact of the reform without also taking account of the current circumstances. So just to give a very brief context to Ethiopia, as you can see on the map, Ethiopia is one of the countries in East Africa, and it has the second largest population in Sub-Saharan Africa, around 115 million people. It's quite diverse, and it has a decentralized regional structure. For the research that we have done for RISE, we've included 7 of the regions, which are representative of most types of regions across the country. This has included 168 schools in total and around 9,000 students who've been included in the first phase in grade 1 and grade 4, with more or less equal proportions of girls and boys. So the intention was to be as representative as it would be possible within the terms of the resources and recognizing the scale of Ethiopia's population and the diversity that exists. So to start with why we were interested in Ethiopia as a country, and why the RISE program, I guess, was interested in including Ethiopia. So Ethiopia has seen considerable increase in primary school enrollment over the past 20 years. Now, this isn't unusual, but probably Ethiopia started from one of the lowest bases 20 years ago. So in 20 years ago, only about 30% of children were in primary school. And now the vast majority of children will have some access to primary schooling, although some still don't complete, as is also quite common in a number of different contexts. And as we know, those who aren't completing are usually from the poorest families, they're the poorest girls living in rural areas, often children with disabilities, and can be also from particular ethnic minority linguistic groups, etc. Again, similar to many other countries, learning levels have remained low. So although there has been an increase in enrollment, the proportion of children who are learning the basics in literacy and numeracy has remained very low and hasn't changed significantly over the past decade or so. I mean, this has to be put in the context of recognizing that with this huge increase in enrollment, obviously the conditions are very different, and the diversity within classrooms that teachers are having to engage with is also very different. So having moved from quite an elite to a mass system within a short period of time, the types of conditions that teachers are teaching in is changed significantly. So there are some things that are similar to other contexts in relation to access and learning. The government of Ethiopia has shown a strong commitment over many years to education and has spent at least 20% of its budget on education. And it's one of the countries that has shown the sort of largest financial commitment. I mean, it should be recognized, like Pakistan, I think that the tax base in Ethiopia is quite low, so the overall resources remain low. It's not that they're sort of considerable resources for education, but the commitment within the scope of the government budget to education is there. In addition, there's been an explicit government focus on quality education reform for at least the last 10 years. This is with support of international donors giving some additional funding. Again, like most other countries, most of the funding comes from government sources. And this programme predates some of the debates that have been on with Sustainable Development Goals. Although it's in line with the Sustainable Development Goals, it's not that quality education reform is only because now the SDGs talk about it. And again, I think that's probably common across a number of countries that, you know, national governments have often been aware of the challenges of quality in the systems and had tried to do things about it. In terms of our research approach, so as I've mentioned, we focused on a nationwide government programme reform, and this is called the General Education Quality Improvement Programme, which is quite a mouthful. So from now on, I'll be calling it GCIPE, which is its acronym. And the focus, there's been 3 rounds of GCIPE over the last 10 years. The most recent one, which is the one that we're focusing on, has an explicit focus on equity, and it's called GCIPE-E. And the 3 areas that the government and donors have identified for this focus are girls, children with disabilities, and pastoralist communities. For our work, we focus particularly on girls and children with disabilities. It's been a lot more difficult to look at pastoralist communities because they're often in communities that are in the high security areas of the country, which pre-existed the current situation in Ethiopia that you are probably aware of, but has obviously also heightened, and these security issues have also affected our more recent work alongside COVID. We've been collecting longitudinal data, both quantitative and qualitative data, to track the evolution at different stages of the reform. So we were interested in seeing, who and how people were involved in the design of the reform, how this different stakeholder engagement has affected the type of design that exists, how the extent to which the GCIPE programme has been adopted and implemented in different areas, and also our intention is to try and look at the impact of the reform, recognising these challenges in terms of security issues and COVID, which have arisen. The part of the programme that I'm going to be talking about more specifically today is the bit in red at the bottom of this slide, which is in relation to the adaptations of the research that we have undertaken in the last 1.5 years or so, which includes phone surveys with teachers, school principals and caregivers, which happened during these school closures. We also undertook an additional round of data collection once schools had reopened to identify changes in enrolment and learning as a result of following from those school closures. And we've also widened the focus to include not only academic learning, so in terms of literacy and numeracy, but also to include aspects of socio-emotional learning, mental health and well-being, recognising this is always important for education systems, but has potentially become even more at the fore in the light of the potential effects of COVID-19. So I'm going to be giving a brief overview of these three areas. It will be brief, but there are publications that are available for you to read further. There are blogs, etc., so in digestible forms as well. I've skipped. There we go. So the GCIPE reform started in 2018. As I said, this is the third phase of the GCIPE reform. It's a multi-donor pooled fund, so it's led by the World Bank. FCDO is also a major funder, but there are other funders such as UNICEF, Finland, and others. It's very directly linked with the government's education sector development plan, which is now in its fifth phase. So any of the initiatives will be in the government's education sector development programme, but it's drawn out the aspects that focus particularly on quality at the primary school level. The programme is coordinated and implemented by the government, and it shows a very strong donor-government partnership. And we've done some analysis also of the sort of ways in which donor and government have negotiated over the processes and the ways in which they've come to agreement and the areas that they haven't agreed on. So that's also some of the work that we've done previously. With respect to COVID-19, again, as in many countries around the world, schools closed in March 2020 as the first cases started to emerge in Ethiopia. They reopened in a phased approach from October 2021. This phased approach recognised that some areas of the country had less access to technology, for example, during school closures, and potentially the children would need more support. So it started with rural areas of the country in the first instance. The government prepared an education sector COVID-19 preparedness and response plan that was released quite early on the April the 3rd, 2020, that included radio programmes while the schools were closed. Not surprisingly, GCIPE implementation was stalled. The schools weren't open and all the interventions were within schools, so it wasn't possible to continue. But the reason why there's a question mark at the top is because there is now going to be an extension of the GCIPE programme, but I think still under debate as to how far and how long. And as I mentioned, there are now sort of in heightened insecurity issues going on within the country. So sort of when we collected our new round of data collection, we weren't able to collect data in Tigray, and we're currently in the stage of expecting to collect another round of data, but obviously being quite mindful of what's going to be possible given that insecurity has spread further throughout the country. So just starting with a quick snapshot from the phone surveys. And again, I don't think this is uncommon, but perhaps Ethiopia, sort of the data from Ethiopia on access to technology is perhaps lower than some other countries. What we can see here is, again, perhaps not surprisingly, a big urban-rural divide in things like access to electricity, where most of the urban population has electricity, but the rural population, only about 58% do. That much higher proportion have access to a television. Importantly, given that the programmes for primary schooling were being provided through radio, we can see that there's only around half of the population have access to radio. Now, perhaps it's a little bit surprising that those in the urban population have less access, but we think that could be partly because some of them are accessing radio through other means, for example, through their smartphones, which they're more likely to have. A reasonable proportion of our sample had a mobile phone of some kind, but that's not surprising because this was a phone survey, and there was about 15 to 20% who we weren't able to follow up with because they didn't have access to phones. I should have said that those that we were interviewing both for the caregivers, which is what this is from, as well as the teachers and school principals, were part of our earlier sample. So we had access to their phones and permission to use their phones from them from earlier rounds of face-to-face data collection. So our overall response rate was quite high. It was around 85%. Important finding, I think, also is that very few, whether in urban or rural areas, have access to the internet or computer. So when there's sort of discussions about sharing information, particularly at lower levels of the education system through websites or whatever, that's just not generally going to be accessible. Through our analysis, we sort of identified quite importantly that the district level. So you've got in Ethiopia, you've got the federal level, the regional level, another level in between, but also then the closest level to the school is the Wereda or district level, that where the information was flowing through to them, they were more likely to be able to inform the school principals, of course, and then the information was also being shared with teachers themselves. Where the information was reaching the teachers, those teachers were more likely to be engaging with parents and caregivers in terms of trying to support learning. So that information flow was quite important. But the reliance on this cascade approach meant that those in more rural areas, more remote areas, were less likely to access this information. So other means of trying to share information would be quite important. And it inevitably, highlighted the importance of making sure that timely information did reach rural areas in particular. We also asked the teachers and head teachers about whether there were types of support that children would need beyond academic learning, because of course we knew during school closures they had in danger of falling behind with a curriculum. And there were a number of different areas that the teachers and head teachers identified that were in need of further support. And this was differentiated by different students from different backgrounds. So I think this is sort of quite striking for those from low-income countries. A significant proportion was suggesting that school feeding was really a priority for them. So although school feeding isn't available in all schools in Ethiopia, where it is available, it obviously was really important for providing nutritional support to children. And once schools closed, there was no longer access to it. For girls, emotional psychological support was identified as being particularly important. And similarly for low performing students, alongside peer-to-peer support. So some sort of variation in the types of support that were identified, but really important to note that, and I think this just reminds us that schools aren't just about the academic learning, but provide all sorts of other support, whether it's through school feeding, whether it's through forms of emotional support, etc. And so the effects of school closures will go beyond just the effects on academic learning. With respect to what has happened since schools reopened, so as I said, we collected some data, and this was also through the RISE programme and also thanks to some additional funding from the Lego Foundation and Gates Foundation. And we identified that perhaps the dropout from school was less than might have been anticipated. I think there were sort of big concerns in Ethiopia, again, like elsewhere, that many children might not go back to school, in particular those that perhaps were already low performers, those from poorer backgrounds, rural areas, etc. But what we found was that around 18% of those who had been in grade 4 in our sort of previous round had dropped out. So, 82% did actually go back to school. So in a sense, that was better than I think we were anticipating. In Ethiopia, the approach was that children would go back to the next grade. So if they had been in grade 4, they would go to grade 5. In some other countries, for example, Rwanda, where we're also doing some work, the children were expected to repeat a year. So if they were in grade 4, they would go back into grade 4. Of the 18% who weren't able to continue, we identified that girls and children who were overage were more likely to drop out. And again, I think we've seen similar patterns in Rwanda and elsewhere with respect to those who are less likely to have gone back. I think we're sort of recognizing that children did potentially go back to school when they reopened, and I think probably around the world there's been excitement of schools reopening and keenness for children to go back, but we do feel that this needs ongoing monitoring as to whether children have been able to stay in school. So while we can sort of show something so quite positively in some ways, we do need to be mindful that it might be that they haven't been able to attend regularly and might have dropped out subsequently. And we will be continuing to monitor that, hopefully with this next round of data collection. So also from some of our preliminary results of looking at what has happened with respect to learning. So we had collected data previously at the start of grade 4 and the end of grade 4 of primary school. And with this subsequent data collection, we then collected data at the start of grade 6 when schools reopened. So the start of grade 4 and the end of grade 4 was prior to COVID, and then start of grade 6 was after the schools had reopened. So as you can see, we've got a blue line and a red line. The blue line is for rural schools and the red line is for urban schools. The red line that continues along the dotted line is what we anticipate, just very crudely, if we project forward learning happening at the same level as had happened pre-COVID. So that's just a linear projection forward, both in urban schools and rural schools. And the solid line is what has actually happened. So what you can see is that there's been a much slower pace in learning following these school closures. And the test was a very similar test. So it wasn't that we had a more difficult test or anything like that. It was very similar things that they were being tested on. And so we sort of obviously concern about the fact that learning has been at a slower pace. And in addition to that, that learning has been particularly at a slower pace in rural schools where learning was already lower. So we can see a sort of big gap between urban and rural schools prior to COVID. And that gap is actually widening following COVID. So real concern, I mean, as I've sort of said previously, in relation to what was happening during school closures and the potential impact that has had as schools have reopened. This might not be surprising for the reasons I was saying earlier, where given that in rural areas they had less access to radios, therefore weren't as able to continue with their learning through radio programs, and no doubt other factors that were hindering their continuation of their learning. As I mentioned, we also broadened beyond the academic learning of literacy and numeracy to also look at socio-emotional learning. So we had collected data prior to COVID again on some aspects of socio-emotional learning, in particular social skills. There were questions from established surveys that have been done in related contexts and adapted to the Ethiopian context. So it went through quite a rigorous process with colleagues in Ethiopia about appropriate wording, appropriate questions to ask. It might include things like asking the children about how easily they find it to make friends, etc. And what we found was that overall there was a decline in social skills since the schools closed, and that again, this is particularly the case in rural areas. So a concern about the effects that COVID has had not only on academic learning, but also on socio-emotional learning. And through some of our related analysis, we identify, as does other research, that there's an important relationship between social skills and children's numeracy skills, and that includes a positive relationship over time. So the ways in which schools might inculcate social skills is really important, not just only in their own right, which clearly it is, but also for their academic learning. We also find that children's social skills are positively associated with their mental health and well-being. So it's a range of different aspects to why we need to pay attention to these things, even more so in the current situation. In addition to trying to look at the perspectives of children in relation to their own social emotional learning, we also used what the World Bank Teach Classroom Observation tool that some of you might also be familiar with. I know that it has been used at some levels in Pakistan as well. And it includes a component on socio-emotional learning practices. It's quite difficult to know whether on a socio-emotional learning practices are high or not. So this is a scale that could go up as far as 3. So if it's only at 1.5, then I think you'd probably consider it to be quite low, but it's a bit normative in terms of what those values are. But I think one thing that is notable here is that the socio-emotional learning practices appear to be higher among the female teachers, more so than among the male teachers. So the green bar being the female teachers. So, something potentially that we want to explore further. So to conclude, we've identified that there are inequalities in access and learning that have already existed, and that these are likely to worsen following school closures and definitely need ongoing attention and monitoring. That those in rural areas have had less access to technology and other forms of information to keep education going during school closures, and that girls and overage children were more likely to drop out once schools reopened. The gap in learning between rural and urban students has widened since schools reopened. So again, there's something that needs ongoing attention, as does not only the attention to socio-emotional, to academic learning, but also to socio-emotional learning, both in its own right, as well as to support academic learning. And we note that this has been adversely affected during school closures. So just to conclude, as I mentioned, there are a range of publications that you can find on our website. I think I'm happy for this PowerPoint to be shared, and then you can click on the link below. And further information about the RISE Ethiopia research can also be found on the RISE website. So I will stop there and look forward to any discussion.
Thank you so much, Dr. Pauline. Fascinating work. And I would request everyone to paste their questions in the chat, please. And while the questions are coming in, I was just wondering, I had a question. So there is this 18% dropout at grade 4 level. So was it the case that in this dropout, the number of girls or children with disabilities was more? Was there a sort of like a difference there?
Yeah, so in that 18%, we found a higher proportion of girls dropped out and children who were overage dropped out.
All right. And
so
one
a
more
larger proportion of those are girls and children who are overage.
And one more question. So you tested students for the socio-emotional learning. So was there a survey done before COVID also? And then there was this post-COVID?
Yes, exactly. So we had asked some questions before COVID. It was part of our design previously. But with the Lego Foundation funding, we were both able to follow up, but we also extended the focus to more aspects of socio-emotional learning, as well as mental health and well-being. We could only compare before and after on the social skills aspect of socio-emotional learning, because that's the only aspect that we had data on prior to COVID. But we have done also some analysis of more cross-sectional analysis subsequently with a bit of a larger data set on socio-emotional learning beyond social skills, as well as I said, mental health and well-being.
Thank you, Dr. Rose. There is a question for you by Dr. Gulab Khan, and he's saying there was a lesser gradient in decline in SEL for boys in urban settings than other groups of students. Were you able to identify underlying dynamics there?
Yeah, thank you. So I think some of this is just very recent sort of analysis. So we're still delving into some of the reasons, and actually we've hopefully, if we're able to do it, so hoping to a qualitative round of data collection soon, where we will explore some of these things further. I think that, it's interesting because, some settings, it's been the case that boys have potentially been drawn more into certain types of work during school closures and might have been more adversely affected. But in this case, it seems that it's been the girls who are more adversely affected. They might have had less support in terms of access to technology. So even where there is technology in the household, there's evidence from elsewhere from Ethiopia, so from the Young Lives survey, for example, that it's more likely that boys will have access, whether it's to smartphones or other forms of technology that allow them to continue with their education. So we haven't had a chance to look at it further in relation to our own data, but those would be some of the explanations, I think. Ethiopia has also conventionally had a very high rate of early marriage, and some recent studies have also identified that early marriage has increased following COVID-19. So that's not necessarily the sort of direct effect on that graph that we're showing, but it certainly will be having an effect, and including in relation to those overage girls who've been dropping out.
Thank you so much. We're waiting for other questions. All right. So you have this comment. So there is another question, and Hafsa is saying that you mentioned that overaged girls had dropped out. What do you mean by overage? Is it the age that is above the required age for that specific grade or class?
Yeah, good question. So yes, it would be children who are at least 1 year above the age that they should be in for that particular age. So say, for example, in grade 4, that they should be age 12. These would be girls who were aged 13 and above.
All right. Okay, any other questions, please? Yeah, I see a hand. Dr. Faisal, please go ahead.
So, Pauline, thank you very much for this. Tell me two things. You know Pakistan context very well. So if you were to think about these, what would be your expectations about what might have happened or might be happening in Pakistan? And also going forward, if there were policy recommendations that you wanted to pass on to the government, either in Pakistan or Ethiopia, what would be the biggest 2 or 3 things that you would say about getting back to where we were or going even beyond that?
Thanks, Faisal. I think I wouldn't be surprised if in Pakistan you also have experience of a slowing of learning or a learning loss. That has been very common across a number of different countries. So what we found in Ethiopia is what's emerging in other countries. I don't know whether there is work that's being done through the RISE program or elsewhere in relation to that in Pakistan. I think it would be very informative to know. And I suspect also it's not just about the overall slowing down of learning, but the widening of inequality, which I would imagine would be similar in Pakistan as well. Regional, provincial differences, definitely sort of concerns about the impact on gender as well. And similarly, I suspect I wouldn't be surprised if it would be similar for in relation to dropout. I mean, it was quite one thing that we weren't so sure about is that for dropout, for example, there wasn't as clear an effect on poverty as we might have expected. That might be because that was sort of very closely correlated with being overage, and with also low performers actually was another thing that was affected. So it would be interesting to know in Pakistan what the relationship with that is. In terms of policy recommendations, so our colleagues in Ethiopia have been working very closely with the government. So part of the reason for us doing these sort of follow-up studies, phone surveys, as well as the follow-up studies, has been a demand from the government for information. And we've been coordinating also with Young Lives and the GAGE program, which is a adolescent girls program, on sort of trying to combine our findings where there's synergies and complementarities. And they did inform some aspects of school reopening. So there were sort of issues around the extent to which to increase the school day, how to address some of the curriculum issues. There were catch-up classes in Ethiopia. So there was, I think, 4 weeks or something of catch-up classes before schools formally reopened. They weren't necessarily as successful as they could have been, given that teachers didn't have the sort of training and support that they needed. But I think the idea was a good one. So sort of some learning from that, certainly. And we are continuing to sort of disseminate these findings about the learning losses. And I mean, one of the sort of interesting things in relation to Ethiopia is that, as I said, that there are these sort of quite serious security concerns, but there is a very genuine commitment at the same time to social development. So, you know, the recognition that rural schools are the most disadvantaged and trying to identify ways to support them, including through the phased reopening, etc., is I think sort of something quite positive, but that there's still ongoing need to really focus on those parts of the country that have been most adversely affected. And so we're continuing to have that ongoing dialogue through with our colleagues in Ethiopia, continuing to have that ongoing dialogue.
Thank you, Pauline. I think it's great to hear different voices. So Dr. Farhat, would you like to go ahead, please?
First, thank you very much. It's really sort of an interesting presentation that in many ways sort of reinforces the fears that we have about the impact of COVID-19 on, inequality and student learning. But I was just wondering if there was, any silver lining. I mean, there were some anecdotal evidence, some newspaper articles in the United States that for some of the minority children, for example, actually online learning, they preferred that because of some of the socio-emotional challenges that they may have faced in sort of face-to-face classroom situations. So I know that Ethiopia is a very different country, but I just wondered if there was anything that was sort of a silver lining in this.
So I have heard also in another context, which it's sort of work in progress, I can't name the country, but it's that there was some evidence that girls in particular, where they were able to access online, that they had some preference for it, particularly where they were facing security issues, gender-based violence and going to school, etc. So, there can be some benefits, but maybe it's also showing where we also need to improve things in relation to the school environment. So yes, I think there's been some evidence from some different settings in relation to that point. And I think, one thing that I've just been struck by is not just in Ethiopia, but across a range of different contexts, whether it includes the UK, US, but also, other contexts in sub-Saharan Africa and elsewhere, that equity has really been at the fore of the discussion. Now, Faisal and I have had many discussions about this in the work that we have previously done in Pakistan in collaboration, but I'm aware there's sort of issues in Pakistan, but it's often previously been quite difficult to get equity at the fore of the agenda for national governments and for some of the global policy dialogue. Whereas with COVID, it's almost taken as given that should be the lens through which we need to really address the sort of strategies and move forward in terms of how we mitigate some of the problems that have happened. So it's not to say that the equity issues have gone away, but just seeing that being a much more explicit focus, I think is very welcome.
Thank you, Pauline. And thank you, Farad, for your question. So we have questions by Amna and then Yaqub. Go ahead, Amna.
Thank you so much. I was actually, when I was listening to you, I could relate a lot of it to what we've learned over this course about how Pakistan is struggling with the same issues. And one thing that's really stood out for me is how it's really affecting the girls in the schools, and the number of girls that's reducing since the kids are coming back to school now, and we see fewer and fewer girls. So what do you think are some things we can do to specifically bring these girls back to school? Somehow encourage them, get their families to send them back to school. What can be done?
Yeah, I think that's a really important question. In fact, yesterday we had a colleague from the executive director of the BRAC Institute for Governance and Development, BRAC University, and he brought home really strongly also the sort of adverse effect on gender. And I know that not necessarily in Pakistan, but in some other contexts, and including in the global discourse again, there's been a bit of backlash about why we're focusing on girls and, sort of we've achieved gender parity, we need to move on. But it's really striking how adversely affected that girls, how much COVID has adversely affected girls. Not to say that boys haven't been adversely affected, but the sort of gender gap, going beyond the numbers, but also including the numbers have adversely affected girls. So I think it's partly about, and I think it relates to something I can see in the chat there as well, actually being mindful that although we have seen progress in girls' education, it's still at risk and it's still vulnerable. So we need to really sort of identify ways to support those vulnerable girls who are making it into school, not taking it as given that we've solved the problem, but continue to see what is needed to support them. As we know, a lot of these issues that affect girls aren't to do with what's happening, or aren't necessarily only to do with what's happening in the schools, but are to do with issues around their domestic responsibilities, whether they're expected to get married early in some contexts, whether they have children at a young age, etc. So I think it's really about trying to address all of these issues in a sort of cross-sectoral way, and also of course gender-based violence that we know is pervasive across a lot of different contexts. So these vulnerabilities have not gone away and have the COVID-19 has potentially exacerbated them and or brought them further to the fore.
Thank you so much. We have Yakub's question. Yakub.
Thank you, Dr. Taiba. Thank you, Professor Pauline. Really interesting and timely insights on impact of COVID. I wanted to ask whether the assessments that you did on numeracy, as well as on socio-emotional skills, were they written tests or were they oral? The reason I ask this is because if they were written, some of the decline in scores perhaps could be attributed to a possible decline in reading skills that may have happened because of the prolonged school closures.
Yeah, so they were written tests. For the academic numeracy and literacy, they were, for those that are familiar, they were sort of an adapted version of the Young Lives test that's been used in Ethiopia for a number of years, and has been designed in collaboration with the government following the national curriculum. The socio-emotional learning was also sort of written. It was guided, so there was somebody in the room sort of guiding them on what the questions were and how to go about, not what to answer, but what the approach to answering them was. There was somebody there to support them, but yeah, they were written, so it could well be some of the issues that you're raising could well be the case.
Thank you, Yakub. Faisal?
So, I've been part of a global group of deans of schools of education, and they're from all over. And in a recent meeting, they were saying, this is at a university level, that the demand for psychological support services has gone through the roof, and all of them have doubled, tripled the supply, but still are very struggling a lot. And you mentioned the same thing, that there are increase in reporting of obviously anxiety, depression, and across all levels. But with younger children, that is more problematic because it's harder for them to voice the demand in the same way. Are there any lessons on what the government can do there? Are there ways of managing this, or is time itself, is that the only thing that will come in as a healer?
Yeah, so I think one of the things that, again, this sort of drives home is that we sort of expect teachers to be able to deal with all these different things in their classrooms, don't we? So sort of be experts on how to deal with psychological issues, mental health issues, alongside being able to do the academic, follow the academic curriculum, etc. And as some of you will be familiar, there's the Education Commission report that came out a few years ago that included a focus on the education workforce, that was trying to argue that the education workforce should go beyond, obviously include sort of support to teachers, but go beyond teachers, recognizing that there's a need for sort of the equivalent to social workers and other forms of expertise within school environments. Now, as we know, the environments that we're talking about are all very resource constrained, so how to achieve that is open to question. But I think the points that you're saying, Faisal, having people who actually understand how to support children in those early years before things really sort of get out of hand, I think is so important. We have colleagues in Cambridge who do work in the Pedal Centre on Play and Early Learning, and they also have some focus on mental health issues, and I think they have been looking at some of these sort of concerns and how to address them. At the moment, that's been in more high income context, but I think it really does deserve, again, this is something that was already a concern before, but COVID has really brought further to the fore as something that's really quite urgent. And I think it relates to a point in the chat as to sort of how can we mitigate the effects that we're seeing now in the future. And I think some of these things are about thinking about these types of services that are needed, regardless of whether there's an emergency or not, but having them in place all the way along, but also being ready for them if such contexts continue.
We have two more questions. Thank you so much. There are two more questions, one from Alina and the other by Shiri. So Alina and then Shiri. Okay. All right. So Shiri.
So Alina has said her mic isn't working.
Yeah, I think it was about recommendations. She was also looking for recommendations, and maybe Alina, you can put your question in the chat again. Shireen, would you like to go ahead?
Yes, can you hear me?
Yeah.
Okay, so basically, I just wanted to share my observations. We've been going to observe schools, and I see a similar pattern, the one you described in your paper, where the teachers were talking about these learning losses and the behavioral issues they're facing once their students are back in school. So I just wanted to know if there's any particular approach that may be used to overcome these hurdles. And also, I mean, I do feel it's certainly something that requires attention, because there has been a gap that, I'm observing that can't or needs to be addressed.
Yeah, I think that sort of relates a little bit to Faisal's question just now. I think I guess a lot of this also comes back to the type of teacher training that teachers receive and professional development that teachers receive. So in Ethiopia, again, not necessarily uncommon, but the type of training they receive is perhaps not as closely related to the reality of their classrooms as would be helpful. So it might be sort of quite theoretical, not necessarily engaged with the types of contexts of the classroom that they're dealing with, and they don't necessarily have training and support in how to address these, whether it's behavioral issues or identifying and recognizing where children are having sort of facing psychological issues, etc. So I in an ideal world, I think it would be about that sort of continued professional development, providing teachers with those forms of support in the types of contexts that they are working. Some of them are working in classes with very large numbers of students, so it's in any case very difficult for them sometimes to be able to address some of these things in those contexts.
There is this, thank you so much. There is Alina's question also. I mean, it's more about, what could have we done differently, and how do we go about things if something like this happens in future? So what goes in our preparedness for this impacts on education?
Yes, I think some of the sort of adverse effects are things that we should already be planning for in a good education system. So the things like providing psychosocial support, the things like making sure that those that are most disadvantaged, that from whether it's to do with their socioeconomic background, being in a rural area, being a girl, are already recognized as needing potentially greater support and recognition of the type of support that they need, and having that as the fore throughout. And I think the fact that it's come as not a surprise, but has come as something that has required this attention, like I was saying earlier about how equity wasn't at the fore previously and now is, that should have just been at the fore all the way along. There was, it's not that it is now a problem and it wasn't before. So I think it's about really putting in place these sort of foundations that are needed, that were already needed, but making sure that they are in place. There's also, I mean, the obvious thing also around technology that, again, it's not a surprise, I don't think, to any of us that some parts of the population have less access to technology, that those in more remote areas are less likely to have access, that also girls and young women often don't have access to their own phones, and where they have to share or get access via their male relatives, that can create problems for various reasons. So these sorts of things, again, awareness, but I think there needs to just be recognition of type of technology that does exist. So if schools are closed, what is it that can happen and how can it best happen, which is going to vary across different contexts, and how can we make sure that we do reach those that don't have the televisions and the internet and the computers, which is going to be, in an Ethiopian context, a very small proportion of the population.
So Pauline, are we saying that we need to really have a good hard look at our teaching, teacher education, and sort of like reframe it in a way that sort of like prepares the teachers for these dimensions and for crisis management? I'm just asking, yeah.
Yeah, so I think that's certainly a sort of important part of it. It's partly about, I mean, like, for example, the psychosocial support, it obviously comes even more important in a crisis situation, but it's not only necessary and relevant in a crisis situation. So I think there's a danger if we think we should just plan for a crisis situation, that might get pushed to a side because people think, oh, well, the likelihood of that happening in the near future might, let's sort of prioritize other things, but recognizing that these are all really important things for an education system regardless. And on top of that, we'll also make sure that we are prepared for future crisis situations. So I think it's a sort of combination of those things.
Thank you so much. Thank you, Pauline. Faisal, would you like to say a few words?
Pauline, thank you so very much for doing this. This is lovely. It's very good always to learn from you, to work with you, but also to see a context like Ethiopia, because there are so many parallels with what is happening in Pakistan. I mean, I did want to ask you another question, but I won't because that will keep you longer, about the four-week remedial program and whether that I'll do in an email maybe separately. So once again, it is lovely to see you at School of Education. Thank you so very much for being here. And we hope and look forward to having many more sessions with you.
Thank you so much. And thank you again for the invitation and all the wonderful questions.
Thank you, Pauline. It really has been an honor and privilege to have you here. Lovely listening to you. Excellent, very informative work, very insightful work, like always. Thank you so much. Thank you, everyone, for being here. Thank you very much. Have a lovely evening ahead.